The suicide prevention hotline number 988 received more than 96,000 calls, texts, and chats during its launch last week. But is this service working? Clinical Director of Psychology with LME, Dr. Jacqueline Flood, joins us now to discuss this topic. Dr. Flood, welcome to the National Desk.
Thank you.
So let's get right into this issue. The nationwide suicide prevention hotline number 988 became available earlier this month, giving people more options to get help if they're struggling. The number builds on an existing network of over 200 crisis centers nationwide. How is it going so far?
So what we know so far, like you were mentioning, without those increase in calls, texts, and chats, is that it really was needed. So this number, that was up 45% from the week before the transition and up 66% from this time last year. So we need it, and that's a fact.
Well, according to the Washington Post, a report shows that police officers shot and killed 178 people between the years 2019 and 2021 in response to calls for help with a mental health crisis. And that's the number of documented cases. Many critics have raised concerns saying that 988 calls are going to end with police intervention. Is that the case?
So the simple answer to that question is yes, it could. Police could be dispatched to your house, but it's really under only specific circumstances and is actually extremely rare. So it's fewer than 2% of these calls that go to this lifeline that require the emergency response. And most of those, honestly, are done with the consent and the cooperation of the caller.
What triggers that? When do calls end up with police being routed there?
So the times that they're going to end up going that direction is when there's that threat of harm to the person or to someone else, when there's that immediate danger that something's going to happen and could not be prevented, and that's going to warrant that emergency intervention.
How is technology playing a role in all of this? Does 988 use GPS technology similar to what 911 uses so that they can always identify where a caller is located?
So actually, no, the Lifeline automatically routes by the area code to the nearest crisis center. So that's different than 911, which, like you said, uses that geolocation.
Let's talk about what's really driving the need for a tool like this, though. What is it that you're seeing right now, doctor, that you think has kind of reacted or resulted, rather, in these alarming numbers of so many people that are calling in need of help right now?
So we're slowly coming out of this global pandemic, and it killed 1 million people in the US, sickened more than 80 million, and it cost many people that momentum and those milestones in their education, their careers, and with their family. So at LME, we did a survey. We conducted that in April, and we found that 26% of parents reported that their children admitted to being suicidal, while 20% reported that their children engaged in self-harm. And those are alarmingly high numbers coming out of the pandemic.
I imagine they're much higher than in the past, doctor?
Yes, absolutely. It's much higher than in the past.
All right. Well, troubling information, but glad to know that there's a system out there to help. Dr. Flood, thanks for explaining it to us, and thank you for joining us here on the National Desk.
Absolutely. Thank you.